Easdent measure consists of a plate with a horizontal bar 1 connected to a Y-shaped fork 2A, 2B, 2C, and two arms 3A, 3B. At the upper side, and the curved handle 4 slides along the edge of the horizontal bar, and two end sticks 5 and 6 on the lower side. The Y-shaped fork can be used to determine the size of Easdent tray for the patients. It can be used to measure the width of the retromolar pad. Line up the single line on the left prong 2A to the center of patient's right retromolar pad. The number of lines on the right prong 2B matched by the center of the left retromolar pad is the size of the Easdent tray. It can also be used to measure the length of the arch. Let the ends of the fork 2A, 2B touch the retromolar pads, and the middle part 2C touch the teeth. The touching location of maxillary central incisor edge or mandibular central incisor edge on the 2C area can give the size of the length of the arch. If you use mandibular teeth to measure, hold the Easdent measure face down. Use your finger to hold at the matching location of the incisor edge. The left side lines are for measuring using maxillary incisor edge. The right side lines are for measuring using mandibular incisor edges. If the patient has no teeth, the touching location of the incisor papilla can give the size in length of the arch. Put a little pip at the incisor papilla. The pip will transfer to the Easdent measure. The circles on the 2C areas are for measuring using the incisor papilla. The size measured from the length may not be the same as the size from the width. Pick the size from the length for Easdent tray. If the size from the width is bigger, the patient has a wider arch. Easdent tray can be put wider after putting in hot water. If the size from the length is bigger, the patient has a narrow arch. The tray can be pushed narrower after putting the hot water. The flat plate containing a horizontal bar connected to a Y-shaped fork and two arms is similar to the Fox plan. It can help establish an occlusal plan horizontally parallel to the interpupil line and the ala trigger line, or called campus plan. On the lower side of the horizontal bar, there is a stick at each end, 5 and 6, and a movable handle, 4, sliding along the length of the horizontal bar. Using the shorter stick 5 and the movable handle 4, the video can be pre-measured from the outer canthus of the eye to the commissure of the lips. Patients can be guided to bite into video at a predetermined distance. Read the video number from the bottom of the horizontal bar. More detail on how to get corrected video using Easdent measure is in the video How to Record Vertical Dimension of Occlusion. The longer stick at the end, 6, and the movable handle, 4, can be used to measure the inner or outer diameter of objects. It can also be used to measure the size of the teeth in the mouth on the model or on the Easdent trays using the inner sides of the long stick and the movable handle. It can also be used to measure the size of a space from missing teeth in the mouth on the model or the Easdent tray using the outer sides of the long stick and the movable handle. When the outer sides of the long stick and the movable handle are used to measure the object, read the number from the top reading line. When the inner sides of the long stick and the movable handle are used to do the measurement, read the numbers from the middle reading line. The two arms on both sides, 3A, 3B, can also be used to measure the size of the teeth or the size of a space from missing teeth in the mouth, on the model, or Easdent tray. Measuring the size and space will be helpful for modifying the Easdent tray for impression for RPD or immediate dentures, or making flippers, or making temporary bridges. Detail will be in how to modify the Easdent tray video.